I am Cheryl Masterson, and I'm doing my persuasive speech on cell phone usage in the operating room. And I want to just introduce my audience first. We have two Case Western Reserve Perioperative students, and we have a new nurse to the OR, and we also have an assistant nurse manager, and yourself, Stacy, our perioperative educator. So thank you all for taking time to do this with me. I chose this topic because it's a hot topic amongst nurses and anesthesia and most disciplines on if we should have our cell phones in the operating room or not. And to me, it's kind of like texting and driving. If you're texting and driving, your eyes are not on the road, it's on the phone. And if you're using your cell phone for entertainment during surgery, your eyes aren't on the patient, they're on the phone. So that's one of the reasons I wanted to talk about this, because it's pretty relevant today with all the electronics that are out, the iPad, the cell phones, the computers, and we use them every day. And some people are actually glued to their cell phones, whether it's any generation. A lot of us are used to looking at it and looking at the websites and looking at Facebook or texting, and it's become part of our normal every day. So a lot of that behavior has moved into the operating room by some people. That's one of the reasons I wanted to talk about it today. So I want to tell you a little bit about myself. I've been a nurse for over 25 years. I've worked in the ICU and the OR. I am a member of AORN, and I'm a CNOR, which is a certification for our operating room nurses. And I'm in management now, where I've witnessed firsthand a lot of the use of the cell phone for the entertainment factor during long cases or even short cases. So it's been a concern of mine and others that it's taken away the focus of the patient and maybe putting them at risk for safety issues. So in AORN also talked about the increase of sentinel events in the last 5 years, and a lot of it has been contributed to distractions. There was an article written in 2014 about distractions, and one of the biggest focus was the cell phone usage or computer usage, so one or the other. So my proposition with this persuasive speech is that the surgical team will not use their cell phone for entertainment during surgery. And that's a whole team, it's all disciplines, it's not just nursing. So the things I want to go over are the distractions, the risk that we're putting our patient at for HIPAA violations, and possible negative effects that can cause malpractice or even negligence from these distractions that were now occurring in the operating room. So with saying that, I also don't want to seem like the fuddy-dud that that's in her 50s and saying that we don't have a good use for cell phone, because I think we do. I think they could be used for communication, nurse to nurse, and saying, hey, do you have such and such in a room? Or educator to staff, hey, let's meet this afternoon when you're done with your cases, or even a management saying, let's talk about your cases today. It's also been noted that management's been given cell phones, and I've read some articles regarding mass communications for when there's danger to either the patients or the employees, such as that there's a fire, or there's a bomb threat, or there's a shooter in. Even though we have our codes, it's a good way to mass communicate to all of management. So there is some uses for the cell phone. In addition to that, there's been articles written by CRNAs that there's apps on there for pharmacy, and maybe you want to look up what your patient's disease is because you're not familiar with it, or the type of surgeries. However, I'm not talking about those uses at all. I'm talking about the entertainment uses that have caused the distractions. I mean, that's a one-time thing. Look something up, and then you're done, and you put it back in your pocket. So even though we have cell phone policies, we're not supposed to have them in the OR, and we also have corporate compliances about taking pictures. This still exists today, where they are bringing them in and just using them for entertainment, and that's where the biggest hindrance is. So we're normally not supposed to have them at all, but we do. It exists. So some of the distractions that have been noted by Perala in 2011 is that when they did an audit in the OR, they saw people not only texting, but Facebook, on LinkedIn, booking flights, shopping, doing Candy Crush. So those things have been noted, like in longer cases, and they start to get a little bit bored, they're on it. It's almost like a normal thing to do anymore. And ARN, with that whole increase in sentinel events, they did a study of 100 cardiothoracic cases, and they specifically targeted to watch perfusionists. And in 2014, they noted that 56% of the perfusionists were on their cell phones while they were on bypass in one form or the other. And 49% of them admitted that they actually sent texts during cases. So that's quite a bit. I was kind of surprised at the amount of usage while on bypass. There's been many times a surgeon will ask you to take a picture, and it used to be they would have a camera, and all the pictures we kept on the thumb drive, and now they're asking you to take pictures with their cell phones because the pictures are so much better. It's convenient, it's handy, they can take it home. So it was noted by Dr. Tim Timclis that he was a neurosurgeon, and he wrote an article about the good, bad, and ugly of cell phone usage in the OR, that if there was any kind of identifying factors for your patient, it was to be considered just like part of the chart. It's part of the medical record. So if anything could identify your patient, that picture actually belongs to the hospital and is considered part of the medical record. So if the surgeon is actually using it to show the family or to put it into the record, they have to make sure they delete it off their cell phones. One of the malpractice lawyers wrote an article in the AMA in 2013 and made note about deleting these photos because our phones automatically will upload, you know how it says to push a button, upload the pictures, and into our computers. And it could be accidentally transferred to someone else if you're shooting pictures off. And unfortunately, we do have staff, either nursing, anesthesia, PAs, that will take pictures in the room and go, this is the gang I work with, you know, it's innocent. I had a hard day at work, and they take a picture and they upload it on social media, Instagram, Facebook, and yes, it does happen. It happens frequently. And there's not only corporate compliance issues there, but it's privacy. And all these are HIPAA violations, and it's you know, not protecting our patients, and it is against the law to do that as well. So from the distractions and some of the things that can happen because the patient can change so frequently, there's some legal issues that, and also medical issues that can lead to malpractice or negligence of your patients. Things happen quickly. Hemodynamically, a patient can crash in a second, and things change very quickly where they start bleeding or hemorrhaging, and you could be looking at your cell phone and look up and go, oh shoot, there's an arrhythmia, and you didn't even realize it, or anesthesia, the same thing, playing a game, and then look up and go, oh darn. So a lawyer named Luthra in 2014 or 15 wrote an article how they are securing everyone's cell phones in the operating room and looking at the activity, and they are actually trying to correlate it with anything that caused harm to the patient or anything that went wrong, and then they look at everyone's cell phone and try to correlate the events with the actual event that happened to the patient. So it's something to consider with even they showed like texting. Well, you were texting when this patient started hemorrhaging. Did you really? Were you paying attention? So they do can subpoena your activities, and you think everything could be gone, Snapchatting or whatever you're using, but they can still find out the activity. Nothing's gone. So it's something to think about. The other is just the distraction and the bad things that can happen, and that may cause a delay in care or a lax in judgment. There was one other thing I wanted to mention about cell phones is that they're dirty. We bring them in from home, and this surgeon, that Tim Kliss, in his article, he wrote how they did a study in ICU, and they swabbed everyone's cell phones from home that they had with them, and 94% had bacteria in it, and predominantly staph and MRSA. So it's one of the dirtiest things. It's like any other phone that we use, and we don't usually wipe them off with bleach, but something to think about now. But we're bringing that into the operating room when a patient's the most vulnerable. So it's another way we could actually cause harm to our patients. So in conclusion, we've talked about three main things, was distraction, risk of HIPAA violation, and causing harm to our patients with either negligence or malpractice, let alone there is policy and corporate compliance issues that we have to abide by. But these are some of the things I would like to propose that the surgical team should not use their cell phone for any type of entertainment while taking care of the patient in surgery. So the next time you're wheeling your patient back and your phone's in your pocket, I hope that you'll consider that they should be your priority and not use the phone in the operating room. Thank you for your time. And I